So here in Canada, there's lots of talk about reopening as if the worst has passed. But Canada's Chief Public Health Officer, Dr. Theresa Tam, says we're still in the peak. Things could get a lot worse, though, around the world. There's a new report out today by the International Rescue Committee. That was a committee, by the way, that was started by Albert Einstein back in the 30s, and it gives a bleak, shocking picture of the global impact of COVID-19 on war-torn countries and developing nations. Their model shows up to 1 billion international infections, 1 billion, and more than 3 million deaths in the world's poorest 34 countries. How accurate are these numbers, and what can and should the world do about it before it's too late? Joining us now is David Miliband. He is the president and CEO of the IRC and the former UK Foreign Secretary. He joins us now from Connecticut in the U.S. Mr. Miliband, first of all, great to have you on the program. I hope you and your loved ones are doing well. This report is stunning and talks about the 34 fragile countries being vulnerable to COVID-19. How dire is the situation?
Thanks very much for having me on, and thank you very much for your interest. Look, we've taken the Imperial College and World Health Organization algorithms, and we've tried to apply them to the 34 conflict and fragile states where the International Rescue Committee, the international humanitarian charity that I lead, works. What we've shown is that although there are some factors that count in favor of these countries, like the relative youthfulness of the population, the density of population means that we're likely to see very large spread. And that tallies to the estimate of between 500 million and 1 billion cases. We've taken account of the fact that some social distancing measures are in place. But we've also gone the next step. We've said, imagine if these countries all had the healthcare system of China. What would that mean for final death toll? I'm afraid that most of them don't have that level of healthcare. But imagine if they did, you'd still end up with 1.5 to 3 million dead as a result of this. Now, what we also show is that there is still a bit of time, because although you're reporting that Canada is at or over the peaks, the same is true for the European countries. In the countries that we're working in, Sub-Saharan Africa, Middle East, South Asia, the tsunami hasn't yet arrived. We're looking at middle of May to end of May as when it will finally hit. And so we're calling on the world to fund the emergency preparedness, the hand washing stations, the triaging of people that could save so many lives.
You say in this report that one of the causes, what's called in the report, global denialism by world leaders. What do you mean by that?
I mean that there's a myopia, there's a short-sightedness, there's a focus on the home front, which is completely understandable, but there's a neglect of the global nature of this disease. And this disease won't be vanquished anywhere until it's fully vanquished everywhere. There won't be a return to normality until you're sure that if you're flying from one part of the world to another, you're not going to contract the disease. And so we're not many degrees of separation from the people across Africa, because if you think about the international hubs that many people go through, they bring people together from all over the world. And so that kind of normality isn't going to return until we take seriously the Nigerias of this world, the huge population, fastest growing population in Africa. It's got to be part of the response plan. Unless we take seriously some of the war zones, Syria, an obvious example, but also some of the humanitarian catastrophes like Yemen, where 24 million people are dependent on humanitarian aid. This calls, actually, for you don't mind my saying so, there's some Canadian values here, because look after your neighbor is something that doesn't just apply within your own country, it's something that the country has stood for globally, and we need more of that.
Do you, first of all, a lot of people now, there's a lot of distrust of authorities, the WHO. There's a lot of distrust of modeling. When you say these numbers, you recognize, Mr. Miliband, some people say, oh, you know what, it's not going to be as bad. They said it was going to be really bad. Here, it's not as bad. How do people trust the models? And that's important if there's going to be action.
That's a really good point. I think we've got to be transparent. We've also got to say where is the uncertainty, and we've been very open about that. Remember, this is the Imperial College, which is seen as the world leader when it comes to this modeling. But obviously, if you change the assumptions, you can get different outcomes. My point is, don't just hope for the best. You've got to plan for the worst and try and mitigate it. And when I say to you that our international aid workers haven't got the soap, haven't got the hand washing stations, haven't got the fever testing kits in order to be able to do this basic prevention, we are really making a bad moral choice, but also a bad strategic choice. Just think about this. The density of New York is 10,000 people per square kilometer. where we work in Cox's Bazar in Myanmar, where you've got 1 million refugees in Bangladesh, 1 million refugees from Myanmar, the population density is 40 to 70,000 per square kilometre. So you've got the conditions for this to run rampant unless you take the preventative steps.
A last question to you, Mr. Miliband. You're speaking to Canada right now. Do you want Canada to step up and do more to prevent this tragedy from happening? What exactly should Canada do right now?
My message is a simple one. Front line first. Canada is a good international aid donor. Let's get the funding to the front line. And it pains me that the UN appeal that came out 4 weeks ago reserved only $100 million for the NGOs. It was a $2 billion appeal. I'm a big supporter of the United Nations, but we need to get the money to the front line, because I've got 30,000 staff, 13,000 employees, 17,000 volunteers and auxiliary workers ready to go to work, but they need the support of the international community to build those isolation spaces, to get those hand washing stations running, to establish the primary care centers that can help cope with some of this disease. We're not going to get thousands of ventilators into South Sudan. There are only 4 in the whole country, but we can improve the preventative health and the primary care.
4 ventilators in all of South Sudan. Just stunning. David Miliband, I really appreciate you joining us. A critical call to action. And again, we've seen this before. If you ignore it, things can be too late. Thank you for your insight, sir.
Thank you very much for your time.